Hi everyone, Aaron Brooks with Perfect Postures, and today I'm going to talk about low back pain. We had a really quite an interesting client come in yesterday with right low back pain, and she was getting some we call sciatica pain down to her leg, and she was getting this chronic tightness in the hip. But really, it was starting with the low back into the glute, and then down into the hip and down into the leg just a little bit. So when we did the evaluation, the thing that was really intriguing was what her left foot was doing and how that kind of gave away what I was going to do with the corrective exercise routine. So it kind of gets a little confusing, but I'm going to try to simplify this. But again, this is very interesting, and these are things that you could look at yourself and kind of identify, like, oh, I can kind of do that. Maybe that's why I'm having some low back pain, or maybe that's why I'm having some hip pain or knee pain. So when we did the evaluation, when we do evaluations, we always look at all four views. So from a front view and then the two side views, every time I had her turn around at one of the views, her left foot was in front of her right. So right off the bat, I'm like, okay, well, there has to be some compensatory going on for that low back. But in her case, it was a compensation that she was trying to set her left foot forward to take the tension out of her left hip. Now, that's important because if you find yourself with one foot in front of the other, if you bring that foot back and you keep it completely neutral with the right side, you may feel tension develop somewhere else in your body. In her case, it was in the left hip. So what she was doing was the left hip was tight, she was moving her left foot forward to take the tension away, and that was now altering what the pelvis was doing. So with the left foot forward, the left side of the pelvis was actually tilting under a little bit, but the right side of her pelvis was actually tilting backwards or anteriorly. So she actually developed this asymmetry or asymmetrical tilt in the pelvis. So again, that's a little complicated, but it's really interesting to see how one part directly affects another part, or seeing a deviation somewhere and how that could be the root cause of something else going on in the body. So with the corrective exercise, we're going to show you an exercise to help relieve any of the tension that you may develop in the hip. So stay tuned.